All right, welcome everyone to Olive Community Services. Today's session has been brought to you with our friends from Sahara. So I'm going to I would like to thank Bilal Kazmi from Sahara for bringing us Catherine Nicklen, and she will be introducing herself and talking more about how Medicare works with MediCal. So welcome, Catherine, to Olive Community Services.
Thank you everyone, and good morning. Thanks for being here. I am going to be giving a presentation today to give you some information about how Medicare works with MediCal. So just give me a few seconds to pull up my presentation on the screen.
Really quick also, Catherine, really quick. If everybody wants to, maybe quickly grab a pen or paper, we'll let Catherine present. And then if you all have any questions, you can bring them up after she's done presenting. But sometimes we forget what we were thinking when someone is talking about a subject. A question might come to our mind. So why don't we, all have a pen and paper ready so we can jot down our questions and then ask her when she's done presenting.
Perfect. And I will go ahead and send a copy of this PowerPoint to Bilal so he can email it to you all after, so you have something to reference. So before I get started, let me tell you a little bit more about the organization that I work with. It's called Center for Healthcare Rights, and we are part of a national network called SHIP, which stands for State Health Insurance Assistance Program. Basically, what the SHIP network does is it provides free local help with Medicare. Because we are in California, the SHIP network is actually run by the California Department of Aging Health Insurance Counseling and Advocacy Program. The abbreviation for that is HICAP. So the reason I mention this is because our name is Center for Healthcare Rights, but we're also known as SHIP, and we're also known as HICAP. So each county in California has its own HICAP office. We serve LA County specifically. So if you live in LA County and you have questions about how Medicare works, or if you need help resolving any issues relating to your Medicare benefits, please feel free to give us a call. Our phone number is 1-800-824-0780. And again, it's a free service. The great thing about the Center for Healthcare Rights and HICAP in general is that we do not sell health insurance. We are not here to promote any particular health plan or insurance company. We are here to provide information and advice so that you know how to use your Medicare benefits. Okay, and for those of you who may live in Orange County, you will have to contact your particular HICAP office for Orange County. And I can give you that phone number at the end of the presentation if any of you are residents of Orange County. And just so you know a little bit more about me, again, my name is Catherine, and I am the Community Education Coordinator at the Center for Healthcare Rights. So my primary role is to go out and educate our community, make sure that our Medicare beneficiaries know that we are here as a free service, and to provide some, educational information about how Medicare works and, different topics relating to Medicare. And I've been at the Center for Healthcare Rights since 2014. So it's been a while. I do know a lot about Medicare, but there's still so much more to know. I am learning something new every day. Unfortunately, the Medicare program is very complex and it's hard to navigate. So anyway, I'm excited to be here with you today. Again, thank you so much for participating in the presentation. So let's get started with some basics because there is sometimes confusion about what Medicare is exactly. So Medicare is a federal health insurance program that provides health coverage primarily to people who are age 65 or older who are entitled to Social Security retirement benefits. So if you are eligible for a Social Security retirement benefit, either through your own work record or you are married or are the ex-spouse of someone who is entitled to Social Security retirement benefits, you will be eligible for Medicare at age 65. And people who are entitled to a Social Security retirement benefit are people who have at least 40 work credits with Social Security. That's equivalent to 10 years of work. And the reason this is so important is that if you are eligible for a Social Security retirement check, either through your own work record or through your spouse's work record, this actually gives you free Medicare Part A, which is the hospital insurance through Medicare. Now, Medicare isn't just an insurance program for people who are over age 65. We also have quite a significant number of people who are on Medicare who are younger than 65. Just the other day, I was speaking to someone who was 38 years old and already on Medicare. And so who are the people who are on Medicare even though they are under 65? These are people who are permanently disabled, who are receiving a Social Security disability insurance check, okay? So if we have someone who's permanently disabled, who is collecting a Social Security disability insurance check, their Medicare eligibility starts automatically 24 months after they've started collecting their Social Security disability check, okay? And we have two disease groups who may also start Medicare early, under 65. These are people with ALS, also known as Lou Gehrig's disease, and people who have end-stage renal disease. In other words, kidney failure that requires dialysis and a kidney transplant. So again, the point here is most people on Medicare are over age 65, but we also do have some young Medicare beneficiaries who are on Medicare because they are permanently disabled. Now, one last category of Medicare beneficiaries are people who are age 65 and older, who perhaps don't have the sufficient work credits with Social Security to qualify for free Medicare Part A hospital insurance. So remember, I said that to be eligible for a Social Security retirement check, you need at least 40 work credits, which is equivalent to 10 years. But, unfortunately, we do encounter older adults who, for some reason or another, don't have the work credits with Social Security. Maybe they came to the US as an older adult, they immigrated and didn't have an opportunity to work and pay into the Social Security system. Or maybe we have someone who always worked their entire life, but maybe they worked at a job that didn't pay into Social Security, right? So whatever the situation is, if we have someone who is 65 or older and doesn't have the 40 work credits with Social Security, we can still talk to them about how to voluntarily enroll in Medicare. As long as they are 65 or older, they're a US citizen or legal resident, and they've lived continuously in the US for at least 5 years. So these folks can decide whether they want to purchase both Part A, hospital insurance, and Part B, which we'll talk about in a moment, or they can just decide to enroll in Medicare Part B. And I know this is all a little complicated. So again, if any of you have questions about your possible eligibility for Medicare, I'd be more than happy to talk to you more at the end. Now, when it comes to Medicare, besides knowing whether you're eligible or not, it's really important to know when you're supposed to enroll. Medicare is very strict when it comes to enrollment periods. And the most important enrollment period is called the initial enrollment period. This is 7 months long. And for people who are becoming eligible for Medicare because they're turning age 65, their initial enrollment period starts 3 months before their 65th birthday. It includes the month of their 65th birthday, and it continues for another 3 months after. So again, there's a total of 7 months to contact Social Security, which is the agency that is responsible for Medicare enrollment. So you have 7 months to contact Social Security and do your application for Medicare. If for some reason you miss your initial enrollment period, you do have access to a yearly general enrollment period. The general enrollment period is from January 1st through March 31st of every year. And if you do an enrollment during this general enrollment period, your benefits won't start until July 1st. So there's a delay, right? So it's really important to not miss your initial enrollment period, because you can't just enroll whenever you feel like it. You'll have to wait until the next general enrollment period. There's gonna be a delay for your benefits to start. And I don't have a slide on this today, but there's always the risk of late enrollment penalties. Some people have called us with questions about why they have a late enrollment penalty for Medicare. You know, why didn't anyone tell them that there was a deadline to enroll, etc. So again, it's really important to keep in mind your initial enrollment period. I won't give too much information on the special enrollment period today, but again, if you have any questions about it, let me know at the end and I'd be happy to review it with you more. But there is a special enrollment period for people who are actively working, who have employer group health insurance. So we're seeing more and more that even though people are turning 65, decide to keep past age 60. And so if their employer offers them employer group health insurance, they might be able to delay their Medicare enrollment until they're no longer actively working, until they lose their employer group health insurance, and they may not be hit with a late enrollment penalty. Okay, so now that we talked about enrollment periods, let's start reviewing a little bit more about what Medicare actually covers. And again, there's so much to know. The presentation today is just an overview, but there are 3 parts to Medicare. You already heard me mention briefly Part A and Part B. So again, Part A is hospital insurance, but it actually covers 4 major things aside from hospital services. It also covers home health care, skilled nursing care in a skilled nursing facility, and hospice care. Hospice care is for people who are terminally ill. And the home health care that is covered under Medicare Part A is only for people who need skilled therapy or nursing care services at home for a short basis, for an intermittent basis, meaning that they don't need those services on a daily basis, right? It's just maybe a few hours a day, and that they need it in the home because they're homebound. So when I say home care under Medicare Part A, I don't mean that Medicare pays for a caregiver to come and help you in the home, or someone to come help you with meals or with showering. No, Medicare does pay for those custodial services. Custodial care or custodial services means that you need help with activities of daily living, like meals, toileting, showering or bathing, maybe some light cleaning around the home. But again, Medicare does not pay for those kinds of services. So that's just a little quick note there, but it's important for you to know. And then Part B is called medical insurance. Some people do confuse that with MediCal, but that's a different program, and we'll talk a little bit more about MediCal in a few minutes. But Medicare Part B is called medical insurance, and it's your coverage for all your outpatient services. So your doctors and specialists, ambulance, x-rays and labs, diagnostic tests, and medical equipment too. So if you need a wheelchair or a walker, or if you're diabetic and you're taking, you need blood glucose testing meters, that's covered under Part B under durable medical equipment and supplies. And then we have Part D, like David. And D, like David, Part D is a little easy to remember because it's D for drugs. So Part D covers prescription drugs or medications. Unfortunately, when it comes to Medicare, costs and the healthcare itself can actually be quite expensive. So once you start using your Medicare benefits, there are pretty high co-pays and deductibles that you have to worry about. So for example, if you decide to stay on traditional Medicare, there is a first day hospital deductible of over $1,400. So what does that mean? It means that if you were to be admitted into the hospital as an inpatient and you are on traditional Medicare, the hospital is going to ask you to pay your deductible, your first day hospital deductible. So the deductible, again, is what you have to pay first before Medicare will cover the rest of your stay, right? And then Medicare only covers 100 days at a skilled nursing facility during any benefit period. This isn't per year. It's per benefit period. And the way the benefit period works is a little complicated. We won't get into it right now, but again, if you have questions about what a benefit period is, feel free to ask me at the end. But the point is, Medicare is limited. They only pay for 100 days in a skilled nursing facility, only 100 days per benefit period, and there are co-pays to worry about as well. For Part B, which remember is the medical insurance, which covers all your outpatient services, there is a monthly premium to pay. The monthly premium this year that most people pay is $148.50. And typically this monthly premium for Part B is automatically deducted from your Social Security check every month. So when a person's Social Security check is deposited into their bank account, they most likely have already had their Part B premium withheld. So instead of getting their full Social Security check amount, they're getting a reduced amount because the $148.50 has been taken out for Medicare Part B. Now, for people who earn more money, who are considered higher income, they are asked to pay more for their Part B. But again, most people pay the standard premium, which is $148.50. So if you remember at the beginning of the presentation, when I was talking about Part A eligibility and the fact that you need 40 work credits with Social Security to be eligible for a Social Security retirement check and to be eligible for free hospital insurance Part A, right? So most people do qualify for free Part A, meaning there is no monthly premium for Part A, but there is a monthly premium for Part B of $148.50. And again, same as we saw with hospital coverage and skilled nursing facility care, there is a deductible and copays that you have to be concerned about. So once you actually start using your Part B services, there is a small yearly deductible. It's not too bad. It's $203 for the year. But the real problem is that once you pay your $203 deductible, Medicare only covers 80% of the cost of your services. So you, the patient, have to worry about, how are you going to pay the other 20%? And so that can be really, it can be a burden for folks to have to worry about, how to pay for this 20% copay. And, 20% of a simple doctor's office visit may not be too much, but imagine 20% of a more expensive service like an MRI or a CT scan, a CAT scan. So 20% can definitely add up. Now, when it comes to Part D, which again is the prescription drug coverage, this is where things get a little tricky because you do have to make a decision about what type of Part D coverage you want. The first option is a prescription drug. This is a plan that only covers prescriptions. That's all it does. So you're only using this plan when you go to the pharmacy to pick up or refill your medications. So if you enroll into a prescription drug plan, you are staying on original Medicare. Some people call it traditional Medicare. Some people call it fee-for-service Medicare. But most people refer to it as original Medicare. Also, some people call it straight Medicare. So any of those terms. And if you stay on original Medicare, you can go to any doctor, any hospital that accepts Medicare, that contracts with Medicare, and they accept Medicare. So original Medicare is really good for people who want to pick their own doctors. They want to see whatever specialist they want to see. They want to visit whatever hospital they want to visit. So it gives you a lot of freedom and flexibility to pick your own medical providers. The second option for Part D is to enroll in a Medicare Advantage drug plan. A Medicare Advantage drug plan is also called Part C, C like Charlie. And these plans are usually HMO plans. And if you enroll into a Medicare Advantage plan, you are assigning or enrolling all of your Medicare benefits, your Part A, your Part B, and your Part D into that particular plan. And remember, I said that most of these plans are HMO plans. So what happens when you join an HMO? You can only go to their network of doctors and hospitals and clinics. So instead of being able to go wherever you feel like it, you have to go to the network of your specific plan. And that's okay for some people. It just really depends on your own personal preference and what your needs are. You know, it's not that one option is better than the other. It just really, again, depends on your own set of circumstances. What I will say, though, is that the Medicare Advantage plans do offer typically much lower costs for their members compared to original Medicare. So if you're on Medicare and you're worried about those really high copays and deductibles that I mentioned earlier, one option you have is to possibly enroll into a Medicare Advantage plan, because these plans usually help control your out-of-pocket costs a lot better. And some of these plans will also offer extra benefits that the regular Medicare program doesn't. So you'll see sometimes ads on TV where the different plans are saying, oh, we cover dental, we cover vision, we cover gym memberships, right? But again, one option isn't necessarily better than the other. It depends on your needs and what you want. And also what doctors, what your doctors accept if you want to keep seeing those same doctors. And as I mentioned at the beginning, that, you know, it's really important to know about your enrollment timeline, right? And I mentioned that for Medicare Part A and B, you have your initial enrollment period when you first turn 65. Well, for Part D, you have that same initial enrollment period. So during that 7-month initial enrollment period, that is your time to enroll in Medicare Part D and to make a decision about whether you're going to enroll in original Medicare with a drug plan or whether you're going to enroll in a Medicare Advantage HMO plan. And then every year we do have the open enrollment for Part D for Medicare. And that is from October 15th through December 7th. And it is usually the one time a year that most people really have to make changes to their plan for the coming year. So if you make a change during open enrollment in the fall from October 15th through December 7th, your new plan starts January 1st of the next year. And one of the presentations that Center for Healthcare Rights is going to offer for you later this year is going to be specifically relating to Part D and open enrollment, because it's really important to know that plans change from year to year, and it's always a good opportunity to shop around and make sure that you have the best coverage. And then, you know, whenever there are any special circumstances, let's say you have kind of like a life-changing circumstance, feel free to give us a call to see if you qualify for a special enrollment period to make a change to your Medicare plan, because there are different circumstances that can trigger a special enrollment period. And there's a lot of different examples. I'm just giving you 3 today. So one big one is if you lose your employer plan that included drug coverage, or if you move, you know, let's say you're in LA County right now and you have your Medicare drug plan and everything is going great, but let's say you decide to move to Arizona or to Florida. That is a special circumstance that triggers a special enrollment period so that you can pick a new drug plan that is more appropriate for the new place that you're living in, because not all plans work in all places, okay? And then the last one I'll mention is if you enter or leave a nursing home, that also will trigger an opportunity for you to make a change to your Medicare drug coverage. And as we saw with Medicare Part A and Part B, there are costs involved. Unfortunately, prescriptions under Medicare are not cheap. Depending on who you are and what kind of prescriptions you're taking, your costs for those medications might be quite high. And depending on which plan you select, you may be in a plan that has a deductible for your prescriptions. Maybe you're in a plan that doesn't have a deductible. Regardless of whether you have a deductible for your prescriptions or not, then you enter these different coverage periods. There's an initial coverage period, then we have a coverage gap or donut hole, and then the last period is the catastrophic coverage period. And I won't go into all the numbers here because I don't want to bore you with all these facts and figures. But again, just know that depending on what prescriptions you're taking, depending on what plan you're in, and depending on what time of the year it is, your costs for your prescriptions might fluctuate. So as you've heard me say, there are some big gaps in Medicare coverage. There are co-pays, deductibles, and premiums that you may have for Part A, Part B, and Part D. And then there's some important benefits that Medicare just flat out does not cover. So the traditional Medicare program doesn't cover things like dental care, routine podiatry, hearing aids, vision services, incontinence supplies like diapers, transportation to medical services, and custodial care. Remember when I mentioned that Medicare Part A covers home health care, but I clarified that that doesn't mean Medicare is going to pay for a caregiver to come to your home, right? And it's because Medicare just does not cover custodial care if that's the only type of care you need, right? So this is where MediCal comes in. So again, the purpose of this presentation today is to talk about how Medicare works with MediCal. So MediCal can really assist people who are low income with some of those Medicare expenses. And MediCal also offers some extra benefits that Medicare just does not cover. So in our office, a lot of the people that we serve do have both Medicare and MediCal. So just a quick reminder that Medicare eligibility is based primarily on your eligibility for either Social Security retirement benefits or Social Security disability benefits. And we have Medicare beneficiaries that are primarily age 65 and over, but we also do have some that are under age 65 that are permanently disabled. MediCal, on the other hand, is based primarily on eligibility, or your eligibility is based primarily on whether you meet certain income limits. So remember that MediCal is a state health insurance program through the state of California. That's why it's called MediCal, Cal for California. And there are different types of MediCal programs available. There's so many different types of MediCal available for different groups of people. We have MediCal for pregnant women. We have MediCal for children. We have MediCal for undocumented immigrants. right? Well, we also have MediCal programs specifically for people who are eligible for Medicare and who are considered older adults, age 65 and over, or who are younger adults, but who are permanently disabled. So again, the big difference between Medicare and MediCal, Medicare doesn't care about your income and your assets, how much money you have saved in the bank, but MediCal does look at all that. MediCal looks at income and assets. Now, the MediCal programs we focus on in our office are for people who are either aged, meaning 65 or plus, blind, or disabled. One of the ways to get MediCal is if you already qualify for SSI, which is a Social Security benefit. It's called Supplemental Security Income. If you already get SSI, then you automatically get MediCal. You don't have to apply for the MediCal separately. They give you the MediCal automatically. If for some reason you don't receive SSI, you can still apply for the MediCal program through the county. So here in the County of Los Angeles, the agency that processes MediCal applications is called DPSS, Department of Public Social Services. So you can contact DPSS to file an application for MediCal. And the MediCal program for people who are aged, blind, or disabled is called the Aged, Blind, and Disabled Federal Poverty Level Program. And there are a couple of other programs that I won't get into today. There's MediCal with a share of cost, and then there's also the MediCal 250% working disabled program. But for the aged, blind, and disabled MediCal program, I wanted to show you the new income limits, because there actually have been some recent changes. As of December 2020, a new law did go into effect that raised the income limit for the aged, blind, and disabled MediCal program pretty significantly. And then this past April, so last month, the income limit was raised again because the federal poverty level was updated. So currently, if you are on Medicare, you're age 65 or plus, or you are a younger adult with a permanent disability, these are the income limits you would have to meet in order to be eligible for full MediCal benefits. So if you're single, your net countable income has to be under $1,482. If you're a married couple, the limit is $2,004. If you're looking at your income and you're thinking, oh, my income is slightly over that, please give us a call, because there might still be a way for you to qualify for full MediCal benefits, because there are extra deductions and things that we can take into account, okay? And then again, MediCal doesn't just look at income, they also look at your assets or your resources. So for a single person, your resources have to be under $2,000. If you're married, your resources have to be under $3,000. One of the questions we get a lot is, well, if I own my own home, I don't qualify for MediCal, right? Well, no, because MediCal does exempt, meaning they don't count the home that you live in. So even if you own your home, as long as you live in it, MediCal doesn't count it as a resource. They also don't count one vehicle. So again, you feel free to give us a call if you have more detailed questions about whether you might qualify or not. And here in LA County, MediCal recipients do have to assign their MediCal benefits to a particular plan. It's different in Orange County. So again, I can't really speak about Orange County, but I can give you the number for your local high cap if you have questions about your benefits. But here in LA County, the two main MediCal plans are LA Care and HealthNet. So you may be kind of familiar with those names already, because you know we hear they advertise a lot. So you may have heard those names. And what these MediCal plans do is they manage your MediCal benefits. So if you need a particular MediCal service, you go through your MediCal plan to get that service. And there are partner plans. So for example, HealthNet is partnered with Molina, and LA Care partners with Anthem Blue Cross, Blue Shield, and Kaiser. And again, most people who are on MediCal have to pick a MediCal plan. This doesn't affect your Medicare in any way. This is just relating to your MediCal benefits specifically. So, again, MediCal covers a lot of the same benefits that Medicare does. But the reason having the MediCal is so important is that it covers a lot of extra things. So if you focus on the right side of the screen, there's a list of those particular benefits, what we would call like those extra benefits that you can only get if you have MediCal. So MediCal does cover hearing aids. It does cover incontinence supplies. So if you need diapers or wipes and protective pads for the bed, MediCal does have a dental benefit. It does cover some vision services. A really important benefit for a lot of our people who have limited mobility is the transportation benefit to healthcare services. And this is for people who are perhaps in a wheelchair, who have to travel laying down on a gurney. So they can't travel by regular car. They need a specialized medical van, right? So MediCal does cover that transportation. But it also includes transportation for people who maybe don't need special transportation, but they just need transportation because they don't have a driver's license, or they don't have a vehicle that works, or they don't have anyone to take them to their medical appointments. So again, if you're having difficulty getting to your medical services, you can call us or call your MediCal plan to find out about setting up transportation, because the whole point is, you know, to help avoid people from missing their appointments. And a lot of people do miss appointments simply because they don't have a way to get to their doctor's office, and that's a shame. So this benefit is designed to help address that. And then one really, really important benefit, again, that MediCal provides is the long-term care. So for people who have run out of their Medicare skilled nursing facility days. Remember at the beginning when we were talking about Part A, I said that Medicare only covers up to 100 days in a skilled nursing facility per benefit period. So what if you had to stay for 120 days or longer than that, right? And MediCal also covers in-home supportive services and adult day healthcare. And in-home supportive services is really critical for people who still live in their home, but they need some help with activities of daily living. Maybe they need some help with meal preparation or with grocery shopping or with some light cleaning around the home, or they need help with bathing, things like that. So if you are in that situation, you can call the county to find out about how to enroll in IHSS, in-home supportive services, so that you can get the help of a caregiver in your home. And depending on what your situation is, the county will tell you how many hours you qualify for. Now, if you do have both Medicare and MediCal, it can be a little confusing to navigate these two insurances. But one of the most important things to remember is that if you have Medicare and you have MediCal, Medicare is your primary insurance. It pays for the majority of your services first. So typically, we'll just say, to keep things simple, we'll say Medicare pays the first 80%, right? And then MediCal is considered your secondary insurance. It pays second, right? So we'll typically, again, just to keep things a little simple, we'll say, okay, MediCal will cover the other 20%. So you are considered 100% covered for the cost of your services when you have both Medicare and MediCal. So you should not be billed for your co-pays, your deductibles, because you have both Medicare and MediCal. And we do see, issues where people who are Medi, who have both Medicare and MediCal, are being billed for their services. And that's called balance billing, and it is illegal. So if you're going through that, please reach out to us if you need help, so that we can step in and possibly provide some education to your doctor's office or your hospital or whoever's in charge of billing, to let them know, hey, this person has Medicare and MediCal. You're not supposed to bill them for the co-pays or the deductibles. And another really important benefit that MediCal provides is that if you have full MediCal benefits, the state of California will pay your Medicare Part B premium. So if you think back earlier in the presentation, I was saying that, most people have to pay $148.50 for their Medicare Part B monthly premium. That's usually deducted from your Social Security check automatically every month. But if you have MediCal, the state of California will start paying your Part B premium for you. So that right there is a huge savings. It's almost $150 a month that you get to keep, instead of having to use it to pay for Medicare Part B. And then if you remember also, I spoke briefly about how expensive prescription drugs through Medicare Part D can be, especially if you take, brand name or really expensive specialty medication. Maybe if you have like a severe or very serious disease or a chronic illness, some of those prescriptions are not cheap at all. But if you have Medicare and MediCal, you automatically qualify for a program called Extra Help. And it's a subsidy that lowers your co-pays for your prescription, so that you don't pay more than $1.30 for your generics and no more than $4 for your brand name medications. For all your other services, remember, you are 100% covered. Medicare's primary and MediCal is secondary. And then you have this low copay for your prescriptions of $1.30 to $4 if it's a brand name. And if you have Medicare and MediCal, you also get a little extra perk, in the sense that you can also make changes to your Medicare coverage once every 3 months during the first 9 months of the year. So if you're not satisfied with the Medicare drug plan that you selected, and we're right now in the month of April, you don't have to wait until open enrollment to make a change for next year. You can make a change now. So it gives you an extra level of flexibility. So you can make those changes throughout the year if you need to. Obviously, we don't want people constantly changing their plan because that can lead to a lot of chaos and confusion, but just know that it's an option. And there are also certain Medicare drug plans that will not charge you a monthly premium, meaning there is no monthly membership fee to be enrolled in the drug plan as long as you have Medicare and MediCal assistance. And then the last thing I just wanted to point out before we stop for questions is to please be aware of fraud. Unfortunately, people with Medicare and MediCal are frequently targeted for all kinds of scams and other fraudulent activity. Right now, the estimate is that Medicare loses about 60 billion. That's billion with a B, not million with an M. $60 billion per year due to fraud. And that's just it's probably more than that, right? But aside from the money that's lost, if you're a victim of fraud, it can have very severe consequences on your health as well. So it's not just about the money, it's also about your health and your safety. So protect your Medicare and MediCal information. Beware of telemarketers and people who come door to door. Don't respond to offers of free services or equipment. Remember, nothing in life is free. There's always a cost somewhere, okay? And then check your statements often to see if someone's charging you for services you never received. So just remember, it's protect, detect, and report when it comes to fraud. And if you need any help with that, again, we are here to serve you. It's a free service. Please feel free to reach out to us if you have any questions. So with that, I will stop sharing the screen. That way we can have time for questions. Thank you so much.
Thank you so much, Catherine. That was amazing. We have about 4 minutes for questions. So either you can put them in the chat box or ask away. I have one question. You mentioned about 40 units, work credit units, if you work 10 years. Where would you be able to know how many units you have?
Yes, so that's a really good question. So remember that Social Security is the one that keeps track of, your work credits and your work history and all that. I know that recently they've been promoting their online services a lot. They're, really having people go online to create a Social Security account, and you can track on there how many credits you have.
Okay, great. Anyone else with a question? Oh.
Question.
Sure, go ahead.
Is there a way to determine if you're thinking of moving out of state, what that might look like, specifically in Texas?
Yeah, definitely. Yeah, so I guess the question I would have is, what is your insurance currently? Do you have Medicare only, or do you have Medicare and MediCal, both, right? If you only have Medicare right now, then we'd want to know, what is your current insurance with Medicare? Are you in an HMO, or are you on original Medicare with a drug plan, and perhaps you have a private supplement or something like that? Because remember, these plans are specific, right, to certain service areas. That's what they call them, service areas. So, one thing you can do is, call up whoever your insurer is and say, hey, do you also provide coverage in Texas? the
Right.
answer
We
may
have
be-
Kaiser, and
Oh,
Kaiser
Kaiser.
is not in Texas.
Yeah, okay, yes.
Yeah.
So that clarifies a lot. Yeah. So if you're in an HMO, a Medicare Advantage plan like Kaiser, and you already know that Kaiser doesn't work out in Texas, then again, you will have a
Right.
special enrollment period. Remember, that was one of the certain special like triggers that can cause you to have a new special enrollment period to pick coverage for your new area. And it's at that point that you would want to really shop around for coverage in Texas. I mean, Texas is probably very different than LA County in terms of what options they have available. One thing you can do is, I don't know if you were here at the beginning, but I talked about how Center for Healthcare Rights is part of SHIP, which is a national network of free Medicare assistance. So I would contact the SHIP in Texas to see if one of their counselors can help guide you on the options out there. And if not, if you're also internet savvy and you feel comfortable using the Medicare website, Medicare.gov has a plan finder tool where you can put in your zip code and see what options there are out there. You can tell it whether you want original Medicare with a drug plan, or you could tell it whether you're looking at HMOs specifically, which are the Medicare Advantage plans. That way you can start seeing like, you know, what companies are out there, what the plans cost and that kind of thing.
Thanks.
All right. So one last, I think this is more like a comment. Somebody mentioned if you have share of cost MediCal, it has no benefits with HMO plan. Does that make sense?
I think, yeah. So I think, so remember when I was talking about MediCal, I provided the MediCal income limits, right? And unfortunately, they are low, so not everyone qualifies. So if you are over the income limit, the county will tell you, hey, you qualify for MediCal, but it's MediCal with a share of cost. And a share of cost is really difficult to deal with. It basically means that you have to pay a certain share towards your medical services before MediCal will help you pay. So it's almost like not really being able to use your MediCal unless you get rid of this share of cost that's in the way constantly, because it's a monthly share of cost. So even if you get rid of it for 1 month, you know, each month you have your share of cost to deal with. And there are ways to get rid of that share of cost more permanently. So if you have questions about that, call us. But yes, if you have MediCal with a share of cost, it means you don't have full MediCal benefits, right? MediCal isn't helping you pay for your services, and you are not eligible to enroll in a MediCal HMO plan. So remember, I was talking about how LA Care and HealthNet are the two main plans for LA County as far as MediCal. If you have a share of cost, you can't join one of those plans because, again, it's like not having full MediCal. Yeah, that's a good question. Good comment.
All right. So thank you so much, Catherine, again. We look forward to your next presentation. I think you did a great job of sharing the most key elements in a very simple way. So I appreciate your pace. It was very easy to understand, and your presentation was great. Thank you so much.
Oh, sorry, I'm muted. Thank you so much, everybody. Thank you for those kind words.
Thank you, Catherine.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.